Why do we close our eyes when we pray, when we cry, when we dream, or when we kiss? Because we know that the most beautiful things in life are not seen but felt by heart. So, heart is important. So, today, 29th September, World Heart Day, is also important. The situation is quite alarming. The disease profile is changing rapidly. The World Health Organization (WHO) has identified India as one of the nations that is going to have most of the lifestyle disorders in the near future. Nowadays, not only are lifestyle disorders becoming more common, but they are also affecting younger population. 31 percentage of urban Indians are either overweight or obese. Obesity can, in fact, triple the risk of heart disease. India has one of the highest numbers of diabetic patients in the world, as many as 30 million and growing by day. Hypertension and stress, especially from work, account for more than 50% of heart ailments. 100 million people in India have high blood pressure. 2 out of 3 employees in India are victim of stress. I don't know about your stress, how much you are carrying, etc. Over 40 percentage of urban Indians have high lipid levels, means cholesterol and triglycerides, that are the major risk factors for heart disease. Heart disease is an abnormal condition of the heart and the heart circulation. It is also known as cardiovascular disease, which is our nation's number one killer. The coronary arteries supply the heart with oxygen rich blood. When the artery is narrow, less blood and oxygen flow to the heart. This is called coronary artery disease. Lack of oxygen to the heart can cause angina or a heart attack. Most cases of coronary artery disease are due to the hardening of the arteries, in which fatty deposits build up inside the coronary arteries, restricting blood flow. Heart disease is the most common and most preventable heart disease of all coronary artery diseases. One of the most common symptoms is chest pain. When your heart muscle is not getting enough oxygen, it sends out a painful warning signal called angina pectoris, and because of your heart needs oxygen the most when it is working the hardest. Angina is most likely to occur during when you are exercising. If the heart muscle is lacking oxygen for long enough, it will die, resulting in a heart attack or a myocardial infarction, which means heart muscle tissue death. The prevention of heart disease should begin at childhood and continue throughout your life. But it is never too late to start, because people of all ages can benefit from diet, exercise, smoking, and stress control to prevent heart disease. You should try to control the risk factors such as cholesterol, high blood pressure, stress control, smoking habits, lack of exercise, and dietary problems. There is no one way to control these factors, but common sense and modern medicine tell us how to. Just stop smoking, eat foods lower in cholesterol, lower your blood pressure with a healthy diet and a lower salt intake, and use daily exercise routine to help prevent disease. Okay, nutrition and diet play a huge role in preventing heart disease. Maintaining a good diet can reduce your risk for heart disease. This is true even if you have a family history or genetic predisposition for heart disease. A diet high in raw fruits and vegetables, whole grains, and omega 3 fatty acids, which are often present in fish, yeah, like me, a South Indian, helps prevent heart disease. The Mediterranean diet is known to reduce the occurrence of heart disease. This diet focuses on eating herbs, nuts, and olive oil, which is a healthy fat, limiting red meat consumption to 1 or 2 times per month, increasing your servings of fruits, vegetables, and whole grains, eating fish twice per week. Many of you may not be taking non-vegetarian, I know that, but eating fish twice per week also very advisable. You will also need to avoid or limit some foods that worsen heart disease. This includes foods with high amounts of sugar and salt, alcoholic beverages, and foods with partially hydrogenated vegetable oil. Exercising and maintaining a healthy weight are also vital to lowering your blood pressure and preventing heart disease. Diabetes is a serious risk factor for heart disease. It has harmful effects on multiple organs in the body when left untreated, and it can lead to peripheral artery disease, stroke, and other complications. You may need to manage diabetes with medications. You can limit the effects of diabetes and reduce your risk of heart disease by choosing healthy lifestyle only. Diet, exercise, weight management, avoiding stress, quitting smoking if you smoke, avoiding smoking, limiting salt intake, ऊपर ऊपर से मत डालो salt, limiting alcohol consumption. Okay, work closely with your doctor and monitor your blood pressure on a regular basis if you know you have a high blood pressure. Take all medications your provider prescribes for your blood pressure and take them as directed. High blood pressure is difficult to detect. Stress affects everyone in different ways. There is a link between people who experience high amounts of stress over long periods and heart disease. Stress can cause sleep loss and headaches and can exhaust the body. Chronic stress can cause the heart to work harder. This will worsen any other risk factors for heart disease you may have. You can adopt many stress reducing habits that will help improve your overall health. Physical activity or exercise is one way to reduce stress. Slowing down and performing relaxation exercises or breathing techniques such as those used in yoga is also helpful. Letting go of worries and spending more time with the family and friends can also contribute to a healthier, more relaxed lifestyle. Nowadays, we are not doing the same. It is also important to get enough sleep. Regular health checks coupled with lifestyle changes can go a long way in prevention, early detection, and cure of diseases. Preventive healthcare involves health promotion, which is aimed at modifying the individual social circumstances and lifestyle, which can be also termed as lifestyle medicine.